and anxiety, and even procedures that could have been avoided. Other health news this morning, it's Suicide Prevention Week. Did you know suicide is the third largest cause of death for adolescents and young adults? And baby boomers is a new area that a lot of people are really taking a good hard look. Some increases in the stats there as well. Dr. Hank Schwartz is the psychiatrist in chief and vice president of behavioral health at the Institute of Living. Good morning to you, and thank you for coming in.
Good morning. Thank you.
So I mentioned baby boomers. The rates in that category are going up, and that's something that's catching a lot of attention.
That's very new. The Centers for Disease Control have indicated that rates for baby boomers between 2000 and 2010 went up 39%.
Wow, that is staggering.
Yes, and more
Why
so
do you
for
think
women.
that's happening?
Well, nobody knows for sure.
Yeah.
I can just say that, people are getting to an age where the baby boomers had great expectations, and they may be looking at the realities of their lives. The pressures also of being that generation in between older generations that they've got to care for and the kids who are still coming up. It's a pressured time for a pressured generation.
Well, and realizing you're not going to be young forever, that's a hard one too, and you sort of associate that with the baby boomers as well. What are some things that that people should look for? We're going to get to some other details, but just to really put it out there, since this is Suicide Prevention Week, what should we look for if we suspect that someone around us is talking in a way that makes us a little nervous?
Well, there's no one picture of the suicidal person, but certainly depression, anger, irritability, withdrawal, diminution of one's performance at work, social disengagement. These are all the kinds of things that contribute to a sense of hopelessness, worthlessness, disconnect, loneliness, and a sense of being or having become a burden to others. That plus the means to commit suicide. These are the risk factors to watch out for.
Okay, let's touch on the means. What is the most frequent form of suicide?
The most frequent form by far is gunshot. Interestingly, more than half of the deaths by gun in the United States occur by gunshot. And the dangerous thing about that is that for people who are impulsively suicidal, the presence of the gun may make the difference between life and death.
Wow, startling. We're hearing the word disease associated with suicide. That also seems new to me.
We're trying to get out the message that suicide, for many, certainly not for all, is a terminal illness. Treatment is available. If one accesses treatment, it doesn't have to become a terminal illness. But for those who are intent on dying, who do not want to share their thoughts with their loved ones, their family, or with mental health clinicians, it can be an unstoppable illness.
I think a lot of people would love to know how we can reduce the risk.
Well, the primary factor in reducing the risk is talking about suicide. It's bringing it out of the darkness. And I think people would be scared
to do that sometimes. Do you find that? That seems like a very tough conversation.
Some people are afraid they'll put the thought of suicide into somebody's head by raising it. There's a sense of shame that attaches to suicide because ultimately it is an act that the individual chooses, and so it may seem like a moral failure. But getting it out into the open and talking about it, starting with friends and family, loved ones, moving on towards mental health professionals, is the single most important thing that we can do.
Well, and Dr. Schwartz, thanks for coming in, because that's exactly what we're doing, is trying to start that conversation right here. So thank you. We really appreciate it.
My pleasure.
And by the way, Suicide Prevention Week runs today through Friday. A reminder for you, here's a number you can take a look at. You can always call the United Way as well.